There's 206 bones in the human skeleton, and they're divided into two general categories or classifications. The first one is the axial, which is the long axis of the body, which consists of the skull, the vertebral column, and the rib cage. They are all found in the midline. And then the appendicular, which is going to be your appendages. These are the bones that will make up the upper and lower limbs. And they're going to have girdles, which are going to attach the limbs to the axial skeleton. If you look at this picture here, you can kind of see the brown is all going to be the axial skeleton. And then what we're going to do is attach to that axial portion these appendages, which are going to be the legs and the arms, and there'll be girdles that will hold them on that we'll talk about them as we go through this in the next few weeks. So those are the two basic divisions of bones, which are going to be axial and the appendicular. Bones are also classified according to their shapes, and there is a long bones, which are considered to be longer than they are wide. Most of these are going to be the limb bones. Let me just show you a picture of them. So anything that's longer than it is wide is considered to be a long bone. So it makes sense that the femur would be a long bone and that the tibia and the fibula would be a long bone because they're long and they're also longer than they are wide. But believe it or not, the phalanges, or your fingers, each one of them are going to be considered by definition a long bone. The second grouping is short bones. These are the ones that kind of look like a small piece of clay that is lumped together, and they're going to be mostly found in the wrist bones and the ankle bones. Sesamoid bones are going to be bones that are going to be found within a tendon, and the best example of that is going to be the patella. So the short bones are definitely not lone. They look like little lumps of clay. And what they're showing here is the tarsal bones, which make up the ankle, and most people know about the carpal bones, which make up the wrist bones. And they are considered to be, and of course, the patella, which is going to be a short bone. So we have the four classifications of long and short bones. Then we're going to have bones that are going to be mostly flat. They're thin, they're flat, and they're slightly curved. So the bones that would be considered by definition a flat bone, the sternum is a perfect example. It looks like a dagger almost. And it is entirely flat, and it starts at the manubrium, goes all the way down to the xiphoid process. But also by definition, the bones that make up most of the skull bones, even though they're curved, are considered to be flat. The same thing with the rib bones. The rib bones are considered by definition to be flat bones because if you took your fingers on either side of the rib, it's flat all the way from where it starts at the spine and attaches to the sternum. So by definition, a flat bone is a flat bone. And then the fourth category is the one that they didn't know where else to put them, and they just clumped them all into a category called irregular bones. They are going to be very complicated in shapes, and probably the best examples are the vertebrae and also the pelvis. So this vertebrae here's a body, here is something sticking up this way, something sticking down, something sticking posteriorly, and there's also a hole going right through the center there. So irregular bones are just that. They're very irregular, but they don't fit into a category which would be considered flat, and they're not long or they're not short bones, but they're their own category, which is considered to be irregular. And those are some of the pictures of how we would talk about them. The thing that I want to talk about tonight is going to be bone markings. So although in the lecture portion, whomever you have teaching that course is going to be talking how bones are going to grow and how they're going to expand and get bigger, the lab portion talks about the bumps on the bone. So bone markings are site of muscle attachments or ligament attachments and a tendinous attachment on the external surface of a bone. I like to think of them as bumps on a bone. Also, some of the bone markings are going to have an indentation, which would be a way to have a blood vessel or a nerve go through that particular bone to get someplace else. So there's three types of categories of bone markings. One is going to be, as I refer to it, as a bump on the bone. It is an outward bulge of the bone. It may be due to increased stress from a muscle pull or a modification for the joint. So essentially it is something that sticks outward from the bone itself. The second category is going to be a depression. And in that particular case, a depression is just kind of a shallow, or as they have a bowl or groove-like cutout that can serve as a passageway for vessels or nerves, or actually it can play a role in a joint of one sort or another. And the third category is going to be an opening. An opening is just that. It's going to be a hole or a canal in a bone that serves as a passageway for blood vessels and or nerves. So those are the three different types of markings: a projection, a depression, or an opening. And they have a chart in this particular textbook of going through all of the modifications. And I'm going to read through these, although any text that you have is going to be very similar, and just kind of, because they're all going to sound exactly the same. For example, a tuberosity is a large rounded projection that may be roughened. The best example of a tuberosity would be the deltoid tuberosity, because it's going to be where the deltoid muscle would attach to the humerus at the shoulder joint. And that's basically it. It's a large rounded projection that probably is roughened. A crest is a narrow ridge of bone. Probably the best way to describe that would be the iliac crest. So the top of your pelvis has a narrow ridge of bone, and it is kind of prominent, and it is considered to be a crest. A trochanter. The only place that you'll have a trochanter is the femur. So if you look over here, there is the big one here, which is called the greater trochanter, and the littler one, which is called the lesser trochanter. But these are large, blunt, irregularly shaped processes, and the only example that we have is going to be in the femur. So if you put down trochanter anywhere else but the femur, it is going to be wrong. A line is just that. It is a line. And so in this particular example over here, this is the anterior portion, you can see the intertrochanteric line. And then as you would go down the femur, there is a line, and they use a Latin name for it, which is called linea. So the linea aspera, which would be on the posterior aspect of your femur, is going to be where your hamstring muscles would attach to the femur, and it is along this line. And the definition is a narrow ridge of bone. It's usually less prominent than a crest. And you'll see that all of these sound somewhat similar. The tubercle is a small rounded projection, and that is basically it. It is just a bump on a bone. And so a rib tubercle is going to be this little tiny bump, and I think there's actually one shown here. So here is a rib, and so here's the facets, and this little bump here is called the rib tubercle. It is just a bump on a bone. An epicondyle is going to be a raised area on or above a condyle. Let me just go to this one here. And so a epicondyle is a raised area near a joint, but not part of the joint. And I really don't have a great picture of this here. So probably the best one as we go through all of the specifics of the bones will be the medial and lateral epicondyle at your elbow. A spine is just like a crest almost. It's a sharp, slender, often pointed projection. And let's see, we do not have a scapula on this one either, but that's the spine of the scapula. Most of the time you can feel that on the back of your shoulder blade, and that is going to be a very important landmark when we start to do the appendicular skeleton, which will designate an indentation above the spine and an indentation below the spine. The process, and believe it or not, the definition just says any bony prominence, which is what they all sound like. They're just a bony bump on a bone. So a process, in this particular one, they're showing you the spinous process here. This is the superior articular process. There would be a process sticking out here, which would be called the lateral process. So they're just going to be a portion of the bone that kind of sticks up, and in this case, it's called a process. The next group, still on projection, is going to be a head. And so if you think of a head, it is a bony expansion carried on a narrow neck. Just think of a regular person. You have a narrowed neck that's going to have a head on top of it. And so in this particular example they have here, this is the rib, and here is the rib neck, and then this larger portion there is called the head of the rib. A condyle, a facet, is a smooth, nearly flat articular surface. So the facets here is just kind of like they cut it in half, and it's going to form a joint with the spine. And that's basically it. It's just a smooth, nearly flat articular surface that will form a joint with some other bone. A condyle is a rounded articular projection. And so the example that's shown here is the mandibular condyle, which is going to go into the mandibular fossa, which is going to make up a joint called the temporomandibular joint. Your lower jaw, which is called the mandible, actually is an upside down hinge, and the condyle goes into the fossa. The ramus, since we're on that there, is an arm-like bar of bone which will go from the mandible up. So this would be the angle of your mandible, and the part that goes up here to the condyle is referred to as the ramus, because it is an arm-like bar of bone that is going to attach something to something else down the hill or something, however you want to think of it. So these are all of the bone markings that would be essentially an elevation. That would be a site of where a muscle or a ligament might attach to a bone, but it was a bump on a bone. It is something that is elevated. The next group are going to be depressions and openings. And I'll go through each one of them, but I'm going to draw my little half circle here and just kind of show you some of them. So this is going to be a groove. This one's going to be a little bit deeper, and that's going to be that one. And I'll go through all of these. And here is a notch, and here is basically a fossa. So this one here is called a groove, and I'll go over each one of them. This one here is called a fissure. This one here is called a foramen. This one here is exactly what it looks like. It looks like a notch. And this one here is a fossa. So that's kind of how I would teach it in lab. And since this is your lab, basically the definition of a groove is a furrow. So if you take a hoe and put it on an angle, you are making a furrow in your garden, which would look like this. So a lot of places that have bones would have a blood vessel or a nerve going through that groove there. The next one is a deeper groove, which is called a fissure. So a fissure, by definition, is a narrow slit-like opening that is a lot deeper than a groove. And you'll see them throughout all of the spine that we does. A foramen is just a hole. So a lot of times the hole, particularly in the skull, is going to be named according to the shape. In this particular case, this is an oval foramen, and there is a place in the greater sphenoid wing called the foramen ovale, which is Latin for an oval hole. There's also one that's going to be round, which is going to be a foramen rotundum. So that's the Latin word for round hole. The next one is a notch. So whereas some places we have a groove, some places will have a notch, which is just basically, that's it, an indentation at the edge of a structure, or a notch that you would have in a bone. As you're looking down there, the next one is called a meatus. The meatus is going to be your ear hole. So on the other side of that mid-sagittal cut head there would be your ear. And if you stuck your finger into your ear, there's a hole, and the hole actually goes into your skull bones. So the external auditory meatus is a canal-like passageway. A sinus, although they don't show any sinuses there, well, I guess they do here, is going to be a cavity within a bone. Because we're coming up on filling up our sinuses season in the Lehigh Valley, it is a hole within a bone that is filled with air and lined with mucus. So a lot of times you are going to have a lot more air than mucus, and if you have a sinus infection, a lot of times that mucus inside of your sinus will be getting rid of the air, and it feels like you have the mother of all headaches because you have a sinus infection. It is nothing more than having an infection in the mucus, which is in this particular sinus. And the last one that is listed there is the last one I have here, and it's an indentation in the bone. So if the bone was just straight, you can kind of see the definition over there is a shallow basin-like depression in a bone, often serving as an articular surface. So in the case of a fossa, you would have some other bone going into the fossa, and you would have a joint that would allow you to move. So basically, these are all the bone markings and the bone definitions of the bumps on the bones or the indentations in a bone that will set the stage for everything that we're going to do for the rest of the axial skeleton and the appendicular skeleton.